Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? We are in the middle of open enrollment. Now, that's the window of time when families and individuals can enroll in healthcare plans and make changes to their coverage options. During open enrollment, it's often difficult to properly communicate instructions and spread awareness about the options that are available, especially in rural areas where internet access is limited and resources are fewer. This year, there are new obstacles to open enrollment. With the continued federal government shutdown, the question about ACA premium tax credits still hangs in the balance, preventing many beneficiaries from knowing what coverage they will need or what they can afford. While some furloughs on CMS staff have been recalled, the administrative support needed for open enrollment is severely limited. This places a strain on staff and slowing down the enrollment process altogether. Many individuals and families are facing hard choices during open enrollment, and their case is not helped by the panic and confusion around what will happen to the ACA marketplace and other forms of healthcare coverage. On to the damage report. Let's review the damage to rural health that we have seen since the start of 2025. And so far, here's what has been closed: 22 hospitals, 26 maternity services, and 18 behavioral health facilities. That is devastating to our rural communities. Now let's look at healthcare staffing cuts since the start of the year. Not only do we have the complexities of these hospital closures, but also hospitals that remain in operation that have cuts to their staffing ratios. The Health and Human Services alone has cut 20,000 positions. The U.S. Department of Veteran Affairs has committed to and has started the process of cutting 30,000 positions by the end of fiscal year 25. Major healthcare systems also have cut around tens of thousands of positions, and that's not even including the jobs that have been eliminated as a result of the hospital closures. As we consider the damages that healthcare has suffered this year, we're reminded of the vital importance of keeping local services and jobs accessible to our rural communities. We've taken several major hits, but rural health is not done fighting. We're going to fight on behalf of our patients, our employees, and ultimately our community families. Today's success story comes from the rural county of Colorado, where suicide numbers have been rising lately. Rural areas are known for higher suicide rates, and between the years 2000 and 2020, rural suicides have almost doubled, and that's according to the CDC. The cause of this is often credited to the extra stress and isolation that comes with living in rural communities. In Routt County, Colorado, a small team consisting of a sheriff's deputy and a licensed clinical social worker is working to change this trend. Their new suicide prevention program targets suicide along with other emergency calls related to mental health issues like domestic violence. The program is supplemented by new school programs and support groups for families mourning the loss of a loved one to suicide and community training for suicide intervention. As the program gains traction, more community agencies are getting involved as they rally around the shared mission to prevent suicide and support individuals struggling with depression. As a provider of behavioral health services, our Hillsdale Hospital family is very familiar with the pain of mental health and the issues related to living in rural areas, including suicide. There are so many positive benefits of rural residency, but as providers of rural health care, we must be diligent to address these issues and support our communities. Thank you for our sources for this episode: MHK, Medicare, X-Talks, VA News, Becker's Hospital Review, the Colorado Sun, and the CDC.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.
Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? After the longest shutdown in the United States history, the federal government finally reopened on November 13th. One of the primary obstacles the House faced in passing a funding package was the decision over extending the expiring enhanced tax credits for the ACA marketplace premiums. While the tax credits weren't extended under the new agreement, the Senate conceded to planning a mid-December vote to look at extending those subsidies, which many healthcare advocates feel may provide the opportunity needed to pass the legislation. Others feel cautious, however, as this deal came from John Thune, the Senate Majority Leader, and was not backed by House Republicans. We'll stay on top of this issue in the weeks to come. On to the damage report. Vital community benefit programs can now continue, but 44 days without an operating federal government resulted in damage to many rural communities across our nation. 41.7 million residents rely on food assistance from the SNAP program every month, and 750,000 federal employees were furloughed or working without pay for over a month and a half. This included the military, law enforcement, airport staff, and the Veterans Administration staff, just to name a few. In addition, many government programs missed grant funding payments, impacting major initiatives like Head Start and cybersecurity projects. During the shutdown, acute care at home, telehealth, and home care services were all limited by expiring Medicare flexibilities. The inactive programs included acute care hospital at home, child care and development, Medicare Tech Health, and temporary assistance for needy families. Community health centers lost $4 million in expired mandatory funding during the shutdown. While some of this damage will certainly be repaired, like retroactive payments to government employees, millions of families lost access to timely care and resources. As some of these programs begin to reopen, communities will have a very difficult road ahead to build and rebuild the resources that families need to thrive. And now to our success story. One of the most rural states in the country is Kansas. While food security has always been a concern in the state, the government shutdown severely exacerbated the gap in nutritional resources. But Kansas residents met the challenge. The key was regenerative farming practices such as adaptive grazing, waterway quality, and soil health to continually restore resources and maximize growth. The whole idea behind this agriculture is to feed neighborhoods more sustainability and affordability. During the federal shutdown, these practices help the residents of Kansas maintain a better access to food and more sustainable farms, even though several important resources and sources of farm funding, like the crop insurance program, conservation reserve program were all inactive. When rural community members like these in Kansas, farmers rising up to take the initiative to provide for their neighborhoods, the damage of lost funds and expired programs can be minimized, which leads to better health outcomes in the long run. Thanks to our sources for this episode: Politico, Bridge Magazine, the National Conference of State Legislatures, the USDA Economic Research Services, KNST, Kansas Farm Food Connection, and WIBW.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.